Hello everyone, welcome to another video on acne awareness. So in today's case scenario, we have a mild comedonal acne case that we are going to be discussing on. So we have a client here presenting to us with comedonal acne, mainly on her forehead area. So do you want to tell us about your acne, like your experience with the acne that you are currently having?
Yeah, sure. So I think I had acne for almost like should be 2 years. But then my skin got way better now, except for the forehead. So I feel a little acne on my forehead. But I couldn't even like recognize that this was acne. I thought it should be texture or something like that.
So can you tell us what are the factors that will cause aggravation, that is like worsening of your comedonal acne? When do you see that there's too much of acne going on in the forehead, now that you know that it's acne? And what are the factors or what are the situations that you see that your acne is coming under control? This is not, like we're not talking about the treatment, we're talking about the factors or triggers here.
So I think it mainly, I feel it's more when I'm traveling out. So if I'm on a vacation, if I'm at home, I don't find much, but only when I roam out, I feel it's more.
Okay. So here now when she's talking about going out and having a lot of acne, this could be because of multiple reasons. One, the pollutants, the dust and the dirt that she's getting exposed to, blocking the pores, one. Or also when she travels to humid environment, so the humidity in the air can also block and clog the pores. That could be the second reason. And third thing is, when you're going out a lot, you end up not washing your face as much, and a lot of also because of temperature variations, you might end up sweating. So the sweat, environmental pollutants, dust, grim, all of these things can block the pores and lead to comedonal acne. Now other than that, now since I have been treating you, so you also have the dandruff aspect, right? You have an oily scalp and dandruff also leading to comedonal acne. So do you see dandruff as a causative factor for your acne?
I think it should be, because sometimes when I'm completely fine, I don't find anything on my forehead. But if I find oily scalp, my hair gets oily too often. So that time I find more.
So one of the main reason for her in her scenario that she's probably realizing now is that her dandruff or the oily scalp is also causing her comedonal acne. So once we have been treating her for her dandruff or the oily scalp, the situation is much better. So that's the history about comedonal acne. Now if you take a closer look at the lesions, she basically has a lot of closed comedones, or the whiteheads that it's popularly known as whiteheads or closed comedones. Now how do we approach a case like this? So if you don't mind, can you just take your mask off? One second. Yeah, not fully. Oh, little. Yeah. So if you see, there's not much of acne on her lower face or her cheeks, very, very slight mild acne. Yeah. So her problem area is mainly her forehead and this part of her face on both the sides. So this is basically associated with the oily scalp, because you see the areas that are being affected, it's mainly the oil dandruff that is from the scalp or around the hairline causing her acne. So first thing is address the causative factor. So first we have to treat the oily scalp, treat her dandruff and keep her scalp clean and clear. So that's the most important thing. So we end up giving her products or lotions that will help in addressing this situation. So here are some of the products that we will recommend in scenarios like this to keep the oily scalp under control. Now once we treat the underlying factors, the other thing that she has mentioned is whenever you go out. So what are the precautions that you need to take when you step out? So first thing is again using the right products as per your skin type. So this sunscreen, when you step out, especially during the daytime, you have to put on a sunscreen, right? So when you are putting on a sunscreen, you make sure that you use a sunscreen that will not block your pores, that is very easy and light on your skin. So use an appropriate sunscreen during the daytime. And also a light water-based or gel-based moisturizer for the night time. So keep your products light yet taking care of the needs of your skin. And let's come to more specific products that she needs to be using. Now when we look at this scenario, we do not have pus, we don't have the pus or the bacteria situation going on. So we can take out antibacterials in this scenario. Okay, what do we see? We see that there are a lot of closed comedones, which means the skin is enlarged little. Like if you people who haven't watched the live that I've done on acne basics, you can please go back and watch that live, because we've discussed everything about formation of acne and different types of acne one can encounter. So if you take a look, it's just that skin that is popped out a little bit with lot of the sebum or the oil underneath it. right? There's not much of bacteria or inflammation going on in this scenario. So what the main product we need, other than the basics like your sunscreen, face wash and moisturizer, the major ingredient or the products that will be needed in this scenario is exfoliation, right? And something that will help in clearing of the keratin plug that is formed underneath her skin. So what we need is the skin to be opened up or the pore to be opened up and let all the oil or the keratin plug that has formed or stuck inside to come out. So we want something that will help in opening up these comedons and letting all the content come out. So what we do in clinic is we do peel. We do chemical peels that will help in doing just this, like we're opening up everything and letting all the secretions come out. So we do, so my approach in this client is, in case we are able to bring a client like this to the clinic, we start off by doing a chemical peel, following up by a good skincare protocol. Now because of lockdown, if you feel you're not able to consult, if you're not able to go and visit a doctor in the clinic and not able to get any chemical peelings done, it's fine. What you can do is to do chemical exfoliation at home, right? So the products, let me take you through the products. So first thing, in the morning, I will still give her a gentle nourishing face wash in the morning. Again, because it's not a very severe case of acne here, I give her still a gentle nourishing face wash in the morning to begin with, followed by a serum that has niacinamide in it. A niacinamide based serum is something that she can use, and then followed by a good sunscreen, again a water based light sunscreen. So you can this is the sunscreen that I'm giving in this client. So something on these lines is something that you can use. So by evening, what happens, you tend to accumulate a lot of oils on the skin, and also through the day, if you're stepping out or even if you're staying indoors, you tend to accumulate a little bit of dust or dirt on the skin. So all of these things have to be cleared up, and your pores have to be cleaned, and they have to be very clean, and they have to be able to receive the products that you're putting on top of it later. So you need to give a face wash that will do that. So for her, we give her a salicylic acid based face wash that will help in doing whatever we just discussed. So morning, a gentle nourishing face wash, but evening we need to give her a salicylic acid based face wash in order to clear up the pores and also take care of the oils and take care of the keratin plug as well. So after the face wash, follow it up by a good, it again depends on the age and severity of the client, for severity of the acne in the client. So for her, we still give her retinol based cream. So first, because her skin isn't very dry, so she can directly apply retinol based cream, and on top of which she can apply a good moisturizer. After which, on individual, now if you see there's not one or two lesions that are standing out. Now that she has one slightly inflamed lesion, I would put a different kind of ointment for these lesions, but the slight tiny comedons, she can use an anti-comedonal cream that we will give her. So we will be giving her creams or lotions that will help in tackling these little comedons. But otherwise in the evening, so there's a face wash, there's a retinol based cream, because she's got the retinols can also help in taking care of these thick comedons, followed by a good moisturizer and topical applications. Now since she has this individual one single acne there that is slightly inflamed, so I will be giving her a cream that has a combination of Adapalene and clindamycin, so that will also help in opening up the skin a little bit, taking care of the bacteria or the inflammation that is going on underneath her skin and clearing that lesion out. So these two lesions are slightly different from the rest of the lesions. These are slightly inflamed, but rest of the comedonal acne, there's no inflammation. It is just comedonal acne. So the major thing we want in this client's routine is a good exfoliating protocol that will help in taking care of all the accumulated keratin plug. Now along with this, we also give weekly protocols, like you can exfoliate your skin by using some chemical exfoliants, like this particular product right here does really good for a comedonal acne skin. So besides this daily routine, you also have things that you do once in a week or 2 to 3 times in a week. So this again mainly is for exfoliation. So you have this particular product that is salicylic acid based product that helps for exfoliation. You also have this particular product that's the exfoliating polish that has magnesium oxide crystals that takes care of the dead skin cells and also controls the oils through the day. It's a very good exfoliating product. It is not too harsh on your skin that will disrupt your skin barrier, but yet it takes care of all the dead skin cells that accumulate or sitting on the skin and blocking the pores. And so there's other product that I forgot mentioning while talking about the daily routine is the oil control pads. So in very severe acne cases or very oily skin, we end up giving oil control pads and its counterpart complexion renewal pads for not so very oily skin. So these pads have dual action mechanism, that they have rough texture to it, therefore they also take care of physically exfoliating your skin, and they also have alpha hydroxy acid pre-soaked pads, so they also take care of chemically exfoliating your skin. So now the dead skin cells are taken care of, and your pores are more receptive to the products you are applying, and also in taking care of the secretions that are being accumulated underneath. So you also have to be concentrating or focusing on not just daily protocols but also like weekly protocols that we give you. So let me just summarize this for you. So what we've just seen is a mild case of comedonal acne. What are the triggers? Mainly her oily scalp. Now if you also see the distribution of her comedonal acne, it's mainly the forehead and along the hairline. So the major reasons being excessive hair oiling and oily scalp and a lot of dandruff, and also external factors like the environmental pollutants. So she also complains of increased severity and also increased number of lesions of acne whenever she goes out and spends long hours outdoors. So there is this environmental factors blocking the pores from the outside along with her dandruff and oily scalp. So these are the 3 triggers. So we have done certain lifestyle modifications like reducing the number of times she oils her scalp, and also every time she oils making sure that oil is not sitting on her scalp for a long time. So you apply oil, leave it on for 2 to 3 hours and immediately take bath, and also immediately after oiling wash your hands and face thoroughly and see to it that the oils are not coming and blocking your pores. So adapting to certain lifestyle modifications is also a very important step. And the other thing is the routine. So initially, because she had a little more severe, slightly severe comedonal acne than what she has now, we ended up doing a lot of chemical peels. So we did chemical peels with a gap of 3 to 4 weeks, or sometimes even 2 to 3 weeks. It depends on how she was presenting at every session. So we did chemical peels along with giving her a good skincare routine that she needs to follow daily. And what is the mantra behind skincare routine for this kind of cases is exfoliation. Exfoliation based treatment or salicylic acid based treatment. Now I would like to name the treatments as well. So in case of comedonal acne, it's salicylic acid based treatment. When you have severe nodulocystic pus filled acne, it's isotretinoin based treatment. So there are different types of treatments, like I always say, depending on the type of acne you have. In her case, like we said, it's basically salicylic acid based treatment. So we give her a salicylic acid based face wash for the evening, and morning a very nourishing gentle face wash. And in her routine, we also give her some niacinamide based serums and retinol based creams that she has to use at night, along with a great water based sunscreen and also a very light moisturizer. Never ever skip using moisturizers, even if you have extremely oily or acne prone skin. Oily skin has nothing to do with moisturizer. Oily skin is very different from a hydrated and a healthy skin. So always use a moisturizer, but use the right one as per your skin type. So yeah, so this is her exfoliation or salicylic acid based treatment for her. And we see her once in a while, and if she has a lot of comedones that are accumulated on her skin, then we also end up doing a chemical peel if needed. So in today's session I have not done any chemical peel. I have only asked her to continue with her protocol. Also she discontinued using oil control pads for a while, so we've added that into her protocol again. So she'll be using these oil control pads along with the salicylic acid based face wash and weekly exfoliation treatment. Also she'll be doing weekly exfoliation on herself at home. So I hope this video was informative. I by no means recommend you take these products or use these protocols all by yourself. This is only to guide you guys on the right kind of ingredients or the products you should be using, but I am not encouraging self-medication or self-treating yourself. Always consult your dermatologist, because all these products will be suitable in different combinations and permutations on different kinds of skin types. So for you to get the right protocol for you, you always need a dermatologist to be hand-holding you till you become a pro in handling your own skin. So yeah, if you have any more queries, you can reach to me on info@dnskinclinic.in, and until then, you guys stay healthy and stay happy.